How are we doing on time? You always have to tell a professor whether they need to be short and to the point or whether we can talk. 5 minutes? Okay. I'm Joe Cronin, and I'm affiliated with the Marketing Institute at Florida State University. And I guess the reason I'm here, and every time I walk into this building, and I've done a number of things with TRB, I get worried every time a security guard walks by that they're going to see, hey, there's that business professor, get him out of this building, he doesn't belong here. But I want to introduce the opportunity to maybe do some new and innovative and cross-discipline research. What had happened is back in the 1990s, I guess, for the last 2 or 3 decades, medical care has been largely moving towards managed health care. And when you talk to the heathens on the business side, managing for-profit companies, they want to know what they're getting out of it. And this is a study that I guess I was told there'd only been 2 kind of studies done really measuring ROI. And the one that I did was in 2006, and I do not want to hold that up as an example of how to do them, because they basically came to me and they were saying, you know, what are we going to do with ROI, or why is ROI involved in this? And I looked at them, I go, how in the world are you supposed to calculate an ROI for an activity that generates no profits? It's kind of you talk about some creative accounting. Never give a marketer a job of creating stuff. So we had to really, and where this all came from, it came from the Florida Department of Transportation had a fund for the transportation disadvantaged, and there were 5 basic functions: medical trips, employment trips, nutrition trips, education trips, and life-sustaining trips. And we've had a fairly long history since about 2000s of government being controlled by those people that, is it Alex? Alex wants to change, and I'm on his side on that. But when you can't, boot them out, sometimes you got to learn to talk their language. And I think my position here, in speaking to you, is saying if you can't beat them, you don't necessarily have to join them. But if you're going to convince them of anything, you got to talk in kind of some of the same terms. So a lot of what we did was we went through, and I tell you, you talk about some creative math. We went through and really looked at cost avoidance. And we came up with the return on investment for a medical trip. We calculated it at $11.08 per return on every $1 invested. And if you look at what we were doing, we were using things like, okay, one trip, basically, we took these things out of the sky. We said one out of every 100 trips avoids a 1-day in-hospital stay. Now, if you ask me where I got that number, I don't, right here in my hip pocket, somewhere in that general vicinity, all right? What I'm hearing today, though, or yesterday, one of the studies yesterday said that they found that transportation managed to reduce recidivism rates or something from 8% or 15% to 8% or 7%. Those kind of numbers are available today. 10 years ago, they weren't available. But we were able to take this back. I mean, going down the road, we showed a 1,108 or 1,108 return on investment for medical, 571 for employment, 1,252 for nutrition, 586 for education, and 462 for life sustaining. And basically what we were doing was going through and we were making assumptions like for the educational programs, for every one trip would enable somebody eventually to get 1 day of employment working 6 hours making minimum wage. I mean, horrible assumptions. But what we were doing 10 years ago, we had no clue. But they took this to the state legislature, and these politicians ate it up. They thought this was the best thing, and I'm sitting there going, don't ask me where I got that one. So it's just, but as you go through and you begin to look at, I mean, I'm with you. To me, it's a lot of the medical trips are quality of life issues, and we should be doing them. But there are a whole bunch of people out there who don't want to fund quality of life. They want to fund things that make their tax dollars that they're putting into it look like they're generating a great rate of return. As an aside, we took 8 Florida counties as a basis for making some of our calculations. Interestingly, I was amazed going through it how many people who were in elected office in the state of Florida owned, they went out and bought fleets of conversion vans, and all these programs they didn't support, they wanted to vote against, they were making a bunch of money off of, and cut that out of the tape wherever it is. I still living in Florida, but you learn a lot of stuff. So my contribution for today is to challenge people to think in a little different way. I mean, we've all been thinking for years, and this is a quality of life issue, damn it, everybody should support this. This is just the right thing to do. Well, if we look at it as, there really are major benefits to keeping people out of the hospital. Having done a lot of work, my real area of expertise is measuring customer satisfaction and service quality. Having done a lot of work with managed healthcare firms, I can tell you they don't like people missing appointments. I mean, there is a real economic benefit to, especially, managed healthcare firms and hospitals as well for people showing up. So there are economic benefits which we have to rethink it. It's not making a profit, it's avoiding a cost. Avoiding a cost is a huge benefit for many businesses. So my challenge is, how do you incorporate that into some of the analysis you do as to the benefits of these programs and tie that into the quality of life issues? Not only is this making people's lives better, but it's also generating a really good rate of return on the tax dollars. All right, so, and we don't like to talk about those things, but sometimes you got to learn to talk in the enemy's language. And I'll shut up now and everybody can take over, yeah.
I want to comment on this from a health perspective.
Let's take it to
one of the things that comes out of this, I think, is the need for the kind of program evaluation we're talking about to be a real collaboration between the transportation side and the health side. And that's challenging because, frankly, a lot of people on my side of the fence, the healthcare side, don't really understand adequately how transportation assistance is important in terms of getting people to care. A lot of health providers are really great when somebody is in front of them. They know exactly what to do, and they provide great care, but out of sight, out of mind. They're much less concerned about the people who don't, it's called a threshold visit, people who don't come for care. But I have to say, I have to put in a word for the cold, hard economics of this. The moral argument, the health equity argument, it's the right thing to do argument, they don't cut it. They really, really don't. And as strongly as we believe in it, we're living in a world where people, even foundations, even the kinds of foundations that used to give nice people lots of money to do good things to help people who need, that's gone. That's been gone for at least 10 years. The phrase ROI is probably wrong. I'm not a health economist. We have health economists in the room, but I have worked with health economists, and the model that works best is what's called a savings analysis. You look at how much you spent, and you look at what was saved as a result of that. I think, Alex, you said something about, whose money is being saved. I was very interested to know that in a savings analysis, it doesn't matter. It looks at money the way I look at money. Money is money. Doesn't matter your money, my money. If we spend X many dollars and we save Y many dollars, and that's a bigger number, it's been a savings. It doesn't matter to whom the savings are accrued. In the healthcare world, you have a lot of not-for-profit providers who save a whole lot of money in Medicaid. So we do our work and government saves the money, but that's a good outcome. But I really would encourage us to get past the aversion to viewing this in a business model and really recognize that when we get a child with asthma to a primary care setting, whereas asthma is under control, that costs, you look at how much the medication costs, how much the visit costs, how many emergency room visits you avoided, how many hospitalizations you avoided, you saved a lot of money. You increased utilization on the primary care side and medication side for $200. You save 2 emergency room visits for $1,500. That's the return on investment. And we really need to be able to make that case in monetized, really in a monetized kind of way, so that if you look at the cost per trip and you look at how much preventable hospital use you've avoided, that's where your savings are. And the reality is you're going to see that with people with chronic conditions. The most was dialysis, because that's the most costly thing.
If I could comment real quickly,
Yeah.
because we're running out of time here.
But I just have to,
Okay, we're
move
running
us
out of time.
past that we don't want to do ROI.
Yeah.
We really have to.
Well, I'm going there as well. Okay, one thing I want to put out here real quickly is there are people in business schools now who are up there willing to help it. In the state of Florida, I don't know the whole country, but the state of Florida, there's the Marketing Institute of Florida State University, which they've renamed something stupid like the Institution for Business Research. But there's Qatar, Center for Transportation Research at the University of South Florida. They work very in close tandem, and it's obvious in the state of Florida. I mean, we have lots of issues with healthcare because of obviously being a retirement mecca. And there are people there now who are really involved in this kind of thing. And I think part of my my mission is to get under the skin of some of the planners. So it's kind of like, it is, the first time I went in into talking about marketing, it says you can't plan your way to success. You got to learn to be reactive. And this is one of those cases where I think you can go and get some help from a business school and do some really neat joint research. And I know you want me to get out of the way.